Senator Omidvar.
Thank you, Speaker. Thank you, Minister, for being with us here today. The Senate Social Affairs, Science and Technology Committee studied the federal framework for suicide prevention, whose mission it is to prevent suicide in Canada. But during our study, we determined that the suicide rate in Canada has remained largely stable over the past 2 decades. That's good news. It hasn't gone up. But it's bad news. It hasn't gone down. And what's more troublesome is that the stable rate obscures the overrepresentation of some populations, Indigenous peoples, and more specifically Inuit and boys and men. So my question to you is your strategy and framework going to pivot from a general population approach to a population-specific approach, given the findings of the study?
Madame la Ministre.
Thank you for the question. Senator Omidvar, I'm happy to answer. I'd like to first of all say thank you for the findings of the SOCI Committee for this, to help us inform us in our work on such an important matter. I agree with you. We have to take a unique approach of understanding the many communities that we have across the country, because if we don't, then we take risk of not reaching the people who we need to reach most. What often guides me in my work when it comes to suicide prevention is the health minister of Nunavut, Mr. John Main, who I work with regularly and has made a heartfelt plea to us for Inuit youth in understanding the unique needs that they have. That helps guide us in our work. We are looking at this from a comprehensive, collaborative framework. We know that we not only have to work with jurisdictions to make sure that we are working together, but engage stakeholders from across the country to understand the crises in their communities, to ensure that we are meeting their needs with interventions that make sense. The framework, as I mentioned previously, will be evergreen. We know that we have to address the changing needs of communities as we move forward.
Senator Omidvar.
Thank you, Minister. Your predecessor, Minister Bennett, appeared before committee and informed us that a new strategy for suicide prevention was being developed. Are you able to tell us whether that new strategy took the findings of the Senate Social Affairs Committee report into account?
Madame la Ministre.
Thank you, Senator. And we have taken the recommendations into account, and we will be sharing an action plan in this spring 2024. And I am encouraged that you will see the deep work that was done by your Senate committee will be reflected in the work there.